Hi, everyone. Good afternoon. It's good to see everyone here. As Jonathan said, my name is Ceasar McDowell. I'm here really to kind of chair this session that's really about the impact on housing and healthcare. We have three people actually with us today. Right here, Randy Albelda, and then next from UMass Boston, Suzanne Curry from Healthcare for All, and then Richard Kirshnick from the Cambridge Residents Alliance. These issues of housing and healthcare, we know, are extremely important for people in this country, particularly for those who are middle class or at the margins of society. I just want to throw a couple of numbers out to you related to housing as it relates to Boston, just to kind of understand the impact of, what's going on in the ecosystem around housing. So 21, that's the percentage of renters who are spending over 50% of their income on housing in Boston. 36 is the percentage of the income, the percentage increase in housing price, right, from 2010 to 2015, right? 36% throughout the city of Boston. In Mattapan, it was 50%, and in Roxbury, it was 70%, okay? There have been about 13,000 new housing units built in Boston in the last 3 years. Of that, only 1,380 are affordable, considered affordable, and 2,000 middle income. And the definition of affordable, you being able to be someone affordable, the income definition of that is you make $100,000 or more, $100,000 or less. So take all that and then realize that in the city of Boston, for example, the median household wealth of white families is $247,000, and the median household wealth of black families is $8. Okay? That's the situation we're in. And as we heard earlier, about 350,000 people in this state actually, get some form of federal assistance to help with their housing. The same story applies to health in a different way. But what we know is that without, kind of the federal dollars that we need in order to support housing and health care, lots and lots of people are at risk.
Okay, I could go first to last. I'll set the table. I'm not going to talk specifically about the budget and housing or specifically about the cuts in health care. Rather, I'm going to talk a little bit more about the impact on low-income residents in Massachusetts. And, Josh talked about inequality, and inequality is a duality. I mean, you don't have really, really wealthy people without also having poor people. So this notion of inequality is this notion of someone benefiting from someone else. And actually, talking about how all the issues that are going to be brought up today, education, health, housing, transit, these are all basic human needs. And the federal, we're talking about cuts in the federal budget to basic human needs in a country that spends very little relative to other countries on basic human needs. One can only meet one's basic human needs if one has enough income, which typically is generated through wages in the United States. Many people don't have sufficient wages. Some don't have sufficient wages because they're not employed. They're not employed either because they either can't find a job or are doing other important work like taking care of children or other family members. Other people do have jobs, but insufficient wages. So the needs for basic human needs, healthcare coverage, housing support, food support, support with or affordable transportation to get to and from wherever one needs to get to, are not secured in the United States. And particularly right here in Cambridge, but in Massachusetts generally, the costs of both housing and healthcare are remarkably high and much higher than they are nationally. So the needs are high. The ability to support those needs are variable and unequal and not distributed equally either. That is, people of color are more likely to have lower wages and higher levels of unemployment than whites. Women, particularly women taking care of children on their own or basically on their own, have among the highest poverty rates in the United States and in Cambridge and in Massachusetts. So when we talk about the federal budget in terms of basic human needs, housing and health care, at the expense of more military, I think you need to shed light on who that affects. The other thing I want to weave into this story is the role of the state itself, Massachusetts, specifically the state. So you took some of what I had to say, which is great, Lindsay and Josh too, about 35% of the budget goes in some form to health, Medicare or Medicaid and other health programs, and about 16 or 17% of the budget, excluding Social Security, goes for income security. So parts of the federal budget are really there and do support largely low-income families. About half of that income, as you said, goes directly to those who are receiving those income, and then about half of that goes directly to the state to distribute that income and provision of services. So the Massachusetts will get hit in two ways with both the proposed budget, which we don't have, but we can see the writing on the wall, coupled with the tax cuts, is that there'll be increased needs and also reduced dollars to meet those needs. And I'm sure you'll talk a lot about Medicaid, so I won't talk as much about Medicaid or housing. But what I would say, I mean, the states, all the states, and actually I think this is one of the contradictions of doing this, is that, and governors will fight back, is that if states are left holding the bag for both housing and health care, they can't do it. States do not have the fiscal capacity at this moment to cover the level of cuts or shifting the burden onto states for providing the supports for both housing and health care. Those are the big items. I mean, transportation is important, but it's not as big an item in the federal budget or in the state budget. And so states will have to figure out what, I mean, this budget is what they call in Europe austerity. We are Greece, or we are soon to be Greece, in the sense of an austerity program being imposed on the state essentially to make the 1% wealthier, and then left to figure out how to deal with raising the revenue to cover some of the lost costs. It's interesting that it's happening in a non-recession period, right? So we have what I'd call trickle-down austerity, and we'll hear a little bit more about it. And even if the cuts aren't as draconian as promised, even if they're just cut 10, 20%, which I think is probably more reasonable, states are going to be left holding the health care bag and the housing bag and also the education bag. And there is no way they can pay for it. And Massachusetts is actually in a better shape than most states, but it will not be able to make up for it. And let me just say that it's low-income families that benefit the most from these programs. They're the ones who have the highest needs. They're the ones who receive Medicaid and housing assistance, as well as food assistance and other things. But intervening in both housing and healthcare are industries that care a lot about having that money. It's like MIT cares a lot about the NIH because they get a lot of money from the NIH. As well as the universities, the hospitals and universities, the healthcare industry in the United States cares a lot about Medicaid. Developers care a good bit about housing, and so at least there's that. Cash assistance, not so much. Workforce and education, not so much. But these two, I think, have a better chance of being saved by their industrial counterparts that care for them. But let me just talk a little bit about what it means to cut, at least what's being proposed to be cut. Housing, as we know, preface, housing in Massachusetts, almost everywhere, including, I think, in Western Massachusetts and other places, is becoming unaffordable for more and more families. Housing cuts will make housing more difficult for low-income families, and as they cut housing, they're also cutting support for community health centers as well as community anti-poverty agencies that essentially advocate for. So it's a complete package of sort of cutting. What will happen with families? Families will move, they'll double up, and it's unclear where they'll exactly move to, but it will create enormous disruption. The employment and wage effects, I would also argue there will, I think that was part of the point of some of the last session is that federal dollars bring dollars to Massachusetts. And those dollars get redistributed in the form of jobs and wages, even at Raytheon, right? And so there's sort of this larger macroeconomic effect that would probably happen in Massachusetts, in which this reduction in federal dollars would in effect be taking money out of the Massachusetts economy, if you want to think of it like that, which will reverberate. Certainly the health industry will tighten its reins. And one response is often to cut labor costs. So it begets more inequality if, in the sense of paying workers lower wages, or as you described with Raytheon earlier, Jonathan, moving somewhere where it's even cheaper. The last thing, and maybe it's a little more hopeful note, I guess, is that these cuts, and you asked earlier how long, I would characterize this as sort of what people call this neoliberal ideology. That is, this notion that since the late 1970s, that markets distribute well, we should promote markets without regulations, and that government should be cut so that people enter the labor market and they support themselves. So I would date this for a long time, and this particular, it's not just the U.S., it's a broad ideology. We forced it on Latin America for a long time. But I would argue that we're near the, well, it's hard to predict, but after 30 years, and this is sort of hyper neoliberalism, I think as you were saying in a different way, but there are contradictions, and they're really important contradictions. That is that if you disinvest continually in both social and physical infrastructure, then you have no social and physical infrastructure. And what that means, of course, is that impedes sort of the very things you need for economic growth. And it also creates contradictions in people's lives and mobilizes them in other ways. So on the one hand, there's this notion of how much can you cut. On the other hand, as long as whoever it is, capital, or whoever's interest this is in, keeps taking away from reproducing the people that need to work and reproducing the ways people get to and from work, it'll strangle its own self, I think, but maybe not soon enough. So what it requires is vigilance, mobilization, working both with local groups, state groups, national groups, or international groups, and I think I will say, and insist on what I would call a new regime. That is, neoliberalism, I think, has played itself out in this enormous inequality and enormous disinvestment in large swaths of even this community. There are, I think Cambridge has a poverty rate of child poverty rate of about 20%, believe it or not, here in billion-dollar MIT. So we have disinvested everywhere, including in one of probably the wealthiest communities in the Commonwealth and in the United States. And it does harm to those families, to, I think, our communities. And it's time to think about a new way to do this. And it'll, by necessity, have to be intersectional, if you will. That is, it will require environmental movements, women's movements, all sorts of ways to confront this, in our view, for well-being as opposed to markets.